Point of need storage for acute care environments. Bring items that you need closer to the patient. We maximize central supply areas. This is really where the material starts to move in a healthcare facility. How do you move that material to the floors now? The traditional method is wire carts. Here's alternate methods. These vertical storage systems can be loaded on the bottom level, maybe in a basement area, and the material could be delivered on the second, third, or fourth floor by adding additional access points. We help nurses improve patient care. Did you know the surge of patients entering the system? There's 78 million baby boomers entering over the next 20 years. There's a nurse shortage today. And did you know that there are a lot of errors in hospital accountability for never events and errors, whether it be patient falls, infections, and negligence? Healthcare workers spend 42 minutes of each 8-hour shift resolving these operational type failures. Nurses spend just 31 to 44% of their time in direct patient care. And evidence-based medicine is influencing facility design. Today, changes in design and new construction of hospitals and renovations are evaluating every step in the process to improve productivity. We need to do a better job delivering items close to these nurses. That's why we created Core Store. 80% of the supplies you need 10 steps away from where you need them. We rethought the design, we reduced the steps, and we enhanced the outcome. Here's a patient floor corridor. This solution reduced the cost of care by 21%. You stock this decentralized nurse server in the corridor. It pulls out and you stop. It reduces patient room traffic by 75%, thus reducing infection. Then, from inside the room, you can access the items. This reduced the stay of patients by 17% because it helped reduce infection in the hospital. Total access to all the supplies right there, thus eliminating wasted time by nurses. Used linen storage is isolated from the clean supplies. And of course, code compliance with fire suppression systems is taken into account. It's anchored into the cabinet. It's a great solution. Here's the new space saver for healthcare. We do floorless rail systems. Let's go on a quick hospital tour of our solutions that we can do to save space, reduce infection. We design areas for bulk storage, active storage areas. You can see that the counter is actually part of the storage solution. Here's a pharmacy application. You move the level in the front to the left or right to access the bulk material in the back. Here's our modular casework design. Outpatient dispensing in a pharmacy. Cleaner sterile storage in an OR sterile core. Store more stuff in less space. Here's another example of it. There's a picture of sutures on the right. Add drawers or accessories to store your sterile supplies. Utilize your existing wire shelving. Add aluminum floor in a sterile core. Utilize your existing shelving solutions, pick it up and put it on a high-density base. Cold sterile storage. Do these systems completely stainless if required. Small sterile core type applications, including wire shelves. Add drawers on the fronts of the systems for fast access. Wire shelves. Catheter racks is an accessory that can fit inside the systems. In-suite sterile storage. There's stainless in-suite sterile storage. You could add a slope top if you needed to. Cardiac catheter storage on the left and our modular casework. More cardiac catheter storage accessories. Rehabilitation departments use our storage solutions. Orthopedics. Path labs use our modular casework solutions. Research labs. Chem labs. You can do stainless steel options if required. Tissue block and glass slide storage. You could use the vertical storage systems to really maximize the space. Patient room solutions with modular casework looks built in. Nurses stations. Nurses storage near the stations. Modular casework allows you to be able to remove panels to quickly access items. Employee and doctor lockers. This reduces the ADA turnaround in a locker room by having bench included. Employee and doctor lounge modular casework solutions. Employee break room modular casework solutions. Doctor dictation modular casework solutions. Medical library high-density space saver systems and fixed shelving solutions. Admitting and discharge areas. Business office and financial services. Central services. Linen storage. Bulk dry food storage. Materials management. Striker support systems, which can be stainless, powder-coated steel, or thermofoil laminate. IT department storage systems. The point of need storage review. Space required for high-density storage systems is approximately 1/2 that of equal volume of open shelving. Storage can be customized with accessories to meet any and all variety of sizes and functions. Point of need storage allows healthcare workers to spend more time with the patient, and we consolidate storage areas within a department. We save space throughout the entire new hospital. We minimize travel distance for patient and staff, maximize access to materials. We eliminate and help reduce unnecessary personnel interruption, and we increase the patient care time. In new construction, we reduce the amount of storage space needed by 50%. In the renovation, we free up 50% of the storage space. Every square foot saved in a hospital saves a lot of money on construction costs, and think of the energy savings too. And then you have the additional cost compounded with less maintenance, insurance, security, and energy. We help inventory control, productivity, and efficiency. Did you know infection control, the national average, according to CDC, for severe MRSA infections to be 46.3 cases for every 1,000 patients? Wow! Kids are 3 times more susceptible to infections than adults. What are we going to do to reduce infections in hospitals? One problem is in all the woodwork and the millwork that they use. This is what happens. Infection just gets in there and grows. You can see. Rusting. Don't touch it. It has infection on it. Who lives in there? Nurses station, the way it's done now. Modular medical cabinets are a much better solution. They can use what they call antimicrobial paint and antimicrobial services that kill 99% of bacteria. They can use powder-coated steel cabinets so that they can steam clean the inside and kill infection. They're completely sealed cabinets with no exposed wood, which eliminates breeding grounds. They're built for a tough and rugged 24-hour, 7-day-a-week operational environment. And the neat thing is they're repairable, reconfigurable, and relocatable. It looks like site-built millwork, but it's really modular. They can move it, modify it, and it's designed to lower infection. All these solutions are available in all types of contracts. Broadlane, Premier, Novation, Amerinet, you name it. 8A small business SDV. These are solutions that will last a lifetime, decrease infection in healthcare facilities, and help healthcare facilities save space and lower operating costs when it comes to energy, maintenance, and security.